Jan, what are the most common mistakes when it comes to controlled drug logging that you see at veterinary hospitals?
Thank you for asking me. I think the first thing is that the doctors or the staff, because they're so busy, don't document it all, or they don't document in real time. And real time is somewhat a difficult concept to grasp, but that means as soon as you touch those controlled substances and you either draw up or count out what you're going to use for that patient, you must stop and document before you move to the patient. Not documenting in a timely manner causes all kinds of problems. So that's the first problem. I think the second problem that I see a lot of is not understanding the difference between daily reconciliation of the controlled substance logs and the DEA's mandatory inventory requirements. So everybody tends to think that when they're putting things in their controlled substance log, they're actually doing their inventory. They're not. They're keeping a daily reconciliation of what they're doing and balancing at the end of each one of those lines. And an inventory that is required by the DEA is biennial. That means it has to be done once every 2 years. Some states require that inventory to be done once every year. Those two things are not the same thing and cause a problem if you don't do your inventory in real time and a daily reconciliation log, or if you're using VetSnap, it actually balances for you. So that is not the same thing as an inventory that is required either by your state every year or biennially by the DEA, which biennial means every 2 years.